next speaker, Dr. Jennifer Choi. Jen is one of our outstanding dermatologists. We were lucky enough to lure her and her husband away from Yale to come join us at our melanoma program here at Northwestern, and she's really been a wonderful addition to our program. She heads up our Oncodermatology program, excuse me, and is up in the Cancer Center with us in our multidisciplinary melanoma clinic. And Jen, I'll turn this over to you and let the questions roll in.
Okay, great. Welcome, everybody. We're so happy to see a lot of people here, and we're hoping that this will be a very educational session for you. So I am going to share my screen, and what we're going to talk about today is why is a skin self-examination important? Okay, so. All right, so basically when it comes to melanoma and skin cancer, there are two major parts in terms of screening. So one that Dr. Grami touched upon is making sure that you get regular total body skin examinations by your dermatologist, because it has been shown that thinner melanomas are associated with physician detection, as opposed to when a patient themselves will find a lesion that seems to be changing or becoming symptomatic, and then that's what brings them into the office. So actually, if you get regular skin exams, it is actually associated with finding the melanoma at an earlier stage. Having said that, skin self-examinations are a very important part in terms of making sure that you can actually detect any skin cancer at an earlier stage as well. So there is benefit from having an observant clinician who is watching over your skin on a regular basis, and then also having the patient play their role as well as other family members. So when you undergo a skin examination, similar to what Dr. Grami was talking about, essentially you should be looked at over from head to toe. That includes through your scalp, your eyelids, your ears, your lips, every part of your body, your nails, in between your fingers and toes. And when we look at your skin, we are using a dermatoscope, and that, like Dr. Grami again was mentioning, this tool allows us to see a lot of detail that we cannot see with the naked eye. And so we are experienced to be able to detect and recognize changes that are specific to melanoma. So when we look at your skin, basically we are deciding if your mole looks benign or healthy, if it may look irregular, what we call dysplastic or atypical, but technically these moles are actually still considered benign. And then, or finally, if it looks like it's a skin cancer like melanoma. And the dermatoscope you heard about, essentially it uses a magnifying lens, a polarizing lens, as well as a light source, and allows us to see a lot of detail that we can't see without it. And so here you can see what we see clinically, and then using a dermatoscope, you can just see how much more detail we can see. This is an example of what we look at, and we can determine very easily that this is a nice benign mole. This is what we call a dysplastic mole or an atypical mole, meaning it does have irregular features, but some of these actually we're comfortable just watching because we're used to actually recognizing what an atypical mole is, but it is actually still benign. And then when you see a lesion like this, we can already tell from the get-go that it looks not good. But with a dermatoscope, it allows us to recognize all these features that we learn to look for. So these pink areas that can be indicative, these black globules, this irregular pigment and blotches, these shiny white lines, all of these are features that we can see in a melanoma. So then the question becomes, okay, in between my office visits with the dermatologist, what can I do to help myself? And that's where the skin self-examination will come in. And there is a statistic that basically first-time melanomas, approximately 75% are actually detected by patients themselves or spouses, friends, or other people. And what that means is if you're not being watched over by a dermatologist, and say someone's never even been to a dermatologist, then it's usually in 75% of cases, the patient will recognize that there is this lesion that's growing or bleeding, and that's what brings them into the office. But several studies have shown that if you do regular skin self-exams, it will lead to diagnosis of thinner melanomas, 50% less advanced melanoma, a decreased risk of a second melanoma, and then significantly lower melanoma-related mortality, which means death from melanoma. So if you're doing this on a regular basis, you will be able to recognize lesions that may be new or changing, and then you can bring it to your dermatologist's attention earlier than if you didn't recognize it. So with that information, basically the National Comprehensive Cancer Network, the NCCN, which is a conglomeration of at least 21 cancer centers around the country, they have come up with guidelines that have included that all patients with stage 1A to stage 4 melanomas be advised to self-examine their skin on a monthly basis. So how do you do one? Essentially, make sure you're in a well-lit room. You want to face the mirror and check your face, ears, neck, chest, and abdomen. And then women, don't forget to lift your breasts to check the skin underneath. You also want to check your underarm areas, both sides of your arms, the tops and palms of your hands, and in between your fingers and under your fingernails. And then you want to sit down and check the front of your thighs, your shins, the tops of your feet, in between your toes and under your toenails. And then you want to use a hand mirror to look at the bottoms of your feet, your calves, the backs of your thighs, and you check one leg and then the other. And then using that hand mirror, you can also check your buttocks, the genital area, lower and upper back, and the back of your neck and ears. Or it may be easier to look at your back in the wall mirror using a hand mirror. And then using a comb or hair dryer, you can part your hair so that you can also check your scalp. And in any of these hard to see areas, you can ask a family member or a trusted friend to check these areas for you to look for lesions that may look suspicious. And then that's what we're going to go over next. Okay, so what do I look for? So the easiest thing to remember are the A, B, C, D, E's. And so A stands for asymmetry, meaning that if you were to take your mole and fold it in half, one half of it would not be exactly like the other half. So it's clearly asymmetrical. Border irregularity means it's not like exactly round or oval, but it can have very irregular or notched borders, something that looks like, just very irregular. Color variation means that within a single mole, you're starting to see different colors. So a lot of moles actually have two tones. They may actually be partly light, partly dark. But if you start to see within a mole that used to be all one color, and then you're starting to see another color within it, or all of a sudden you see a black dot within it, or all of a sudden you see a red dot, or all of a sudden it becomes very pink or red, some kind of color changes would be a possible sign. Diameter meaning over 6 millimeters, which is the size of a pencil eraser. So many people have lots of big moles that are already over that size, and they can be completely benign. But if you see a mole that's starting to grow in size, maybe starting to grow in size quickly, maybe a mole that already is big, and then you're starting to see other changes like color variation within it, that's something to look for. E means evolving, meaning it's changing in any way. So you're looking at it, and then all of a sudden, like a couple months later, you're realizing that, again, it's either bigger, it's changing color, it's just changing another way. And finally, S means suspicion. So it's kind of like this gut feeling that, like this red flag, meaning I just have a gut feeling that something isn't right. That actually can be a sensitive indicator. Some people will come in and just say, I just had a gut feeling that something is wrong with this, and it ends up being something. At the same time, people do have that, and they come in and we actually just reassure them that it still looks fine. But if you do ever have that gut feeling, it's definitely a reason to go check it out with your dermatologist. And then we're just going to finish off by looking at a couple images. So these are things that you can look for. So superficial spreading melanoma is the most common type of melanoma that accounts for about 70% of all melanomas. And this is the type that usually will have some of the features of the A, B, C, D, E's. And so you can have here, they're starting to get color variation within this. Again, you can see starting to see different colors, and the border starting to get irregular. Here, it looks very dark on one end, and there's almost some pink on this end. And then here, same thing, there's a pink part plus a dark part here. These are all images also. So again, you can see a lot of color variation. The borders almost look notched and irregular. Here, again, lots of color variation. This one here, there's more darkness in this area. Same with this. And then this is an example of where actually this patient had a melanoma, which was the scar, and then she developed a pink patch that was coming out of the scar. And even though it was pink, it ended up being actually recurrence of her melanoma. Nodular melanoma accounts for 15 to 30% of melanomas. And these are the types that actually may not follow the ABCDEs. So they often look very round, have regular borders, but the key to this is that it starts off and then it starts to grow quickly. So these usually can double in size within a matter of months, whereas superficial spreading melanomas, they can increase slowly over months to years. So the nodular melanoma will start off and then grow quickly. So if you see something that looks either pink, red, black, brown, it starts off as a small little, almost like a pimple, but then grows quickly, that would be something that you want to seek attention for. This is the amelanotic melanoma. So these are the types that actually can be pink or red. And so it can look like almost like a pimple that's not going away, but it's growing rapidly. These should not be confused with those cherry angiomas, which are very common, and people sometimes have hundreds of them on the skin, which are those bright red little round dots that basically are collections of blood vessels. Those are totally benign. So it's more like a new pink or red growth that, again, is singly growing rapidly or starts to bleed. Lentigo malignant melanoma accounts for about 10 to 15%, and this is the kind that most typically will be diagnosed in patients aged 60s to 80s. These are sunspots that start off when, oftentimes 40s, 50s, and then it slowly grows and changes over decades. And over time, it starts to expand in size or starts to change in color. And so typically these are ones that we will diagnose in the office, but if you have a relative or a grandparent and you actually see something like this on their face and they've never seen a dermatologist, I recommend that they actually have it at least looked at. These are other examples where you're starting to see these large patches, sunspots, but they actually start to change in color. And here's one that's more subtle, but you can see it's starting to become darker in one area than another. And then acral melanoma basically accounts for 5 to 10%. And these are melanomas that can occur on your toes, your fingers, the palms, and the soles, and under your nails. These are not as common, but in Black skin, it accounts for 70% of all melanomas if they're going to occur. And in Asians, it accounts for 40% of all melanomas. And that's mainly because the other types are much less common. But keep in mind that acral lentiginous melanoma can occur in any skin type. So any skin type can actually develop it. We don't think this is as associated with sun exposure. So we actually don't exactly quite know why people get this because it's not necessarily due to sun exposure. But this is something to look out for because these are often misdiagnosed as fungal infections, fungal toenail infections, sometimes even warts. Sometimes people think it's just a bruise or trauma, but then it doesn't go away. So if you ever see discoloration on your hands and feet, fingers, toes, that's not going away or slowly changing over time, please seek attention and make sure you have it examined. And again, another thing is that these can often start off as a single brown line, but then over time it starts to grow darker or starts to expand in width. And sometimes it will be associated with this little nick in the nail. And so if you have anything like that, again, have it looked at. These are examples of other ones, which are large pigmented patches on the underside. So thank you for your attention. I'm happy to take questions, but this is basically just emphasizing the fact that you need to make sure you get your regular skin checks by your dermatologist. Also look over your skin on a monthly basis.